Is your hairline receding? For ladies, is your mid-partition widening? Or has your ponytail become thinner? Today in this video, we are going to discuss about a condition that affects millions of men and women throughout the world. We are going to understand why do we lose hair as we age, and we are going to discuss everything that you need to know to understand the basics of male or female pattern hair loss, which is popularly well known by its medical terminology known as androgenetic alopecia. Simply put, this is age-related hair loss. Now, there are a few celebrities like Ricky Lake who've spoken openly about suffering from severe androgenetic alopecia. But if you thought that most celebrities that you see on screen having healthy locks of hair and a very healthy hairline is all natural, then I'm going to burst your bubble right here and I'm going to make you aware about the complete truth. To our lovely community out here, hello and welcome to the Doctor family. If you're new to this channel, I'm Dr. Sanoba Doctor, fondly called as Mrs. Doctor. I am a board certified dermatologist practicing integrative and holistic dermatology, and we discuss skincare, holistic health and everything related to lead a healthy and happy life. This video is a continuation to the hair care series that we have been discussing in the last so many weeks. You can find the complete playlist. As always, I'll leave the link to the detailed blog post in the description below. In this video, we are going to understand why do we lose hair as we age, what are the causes of age-related thinning or pattern hair loss, when does male and female pattern hair loss actually begin, and how can you identify the signs and symptoms of age-related thinning or pattern hair loss in yourself. So without any further ado, let's begin. Hair has always played a very important role in the history of mankind. The Egyptian civilization paid a lot of importance on having healthy hair. The Romans considered the hair as a symbol of beauty, masculinity, class, and intellect. And in today's era, having a head full of hair is considered a sign of youthfulness and vitality. But as you age, your body undergoes many changes, and your hair is no exception. For most people, including myself, hair loss is associated with significant stress. And I know of thousands of people who've got deeply affected with their balding scalps, which has actually led to a lot of social anxiety and interfered with their well-being as well. So let's understand why do we lose hair as we age, so that you can stay worry-free knowing that its occurrence is not entirely your fault. If you have been following me in our hair care series, you know that hair is made up of the protein keratin, and every hair follicle undergoes a cycle of growth, rest and regress. A single strand of hair has a normal life of 2 to 7 years, but because of various factors that we are going to discuss, this entire life cycle gets shortened. Especially the growth phase of the hair's life cycle gets shortened, and this results in thinner and finer hair. And if this continues to progress, it can slowly lead to baldness. But why should that happen, you may ask? There are a number of factors to blame. The theories that were once proposed to be causing this fall of hair loss and hair thinning have been challenged from time to time but have been proven again. So for the sake of simplification and understanding, I like dividing the causes into 3 broad categories. These are genetics, age, and hormonal influence, or a combination of all 3. When it comes to genetics, it has been documented that the baldness trait is present on the X chromosome. This means that if your mother's father experienced a process of hair miniaturization, then you're more likely to experience it. But it can be passed down from the father's side as well. In fact, if you have a strong family history of age-related hair loss or pattern hair loss, then there is a very high chance that you or your subsequent generations might suffer from it at an earlier age. For example, my father, my grandfather, and my great-grandfather, and I'm assuming all the generations before as well, all experienced severe pattern hair loss. And this is true in my mother's family side as well. Hence, I'm not surprised to see myself and even my little one as well to have fine and scarce hair in the areas that get affected very typically. Another important cause is the hormone DHT, that stands for dihydrotestosterone. It is the male sex hormone that is derived from testosterone, and it belongs to the group of androgens. The conversion of testosterone to dihydrotestosterone takes place by the action of the enzyme 5-alpha reductase, and under the influence of these androgens, the hair follicle undergoes a process known as miniaturization. In fact, the previous and more popular term in the medical world for this condition was androgenetic alopecia, since it was believed that this condition occurred because of the excessive response to androgens. Now, what exactly does hair follicle miniaturization mean? Hair follicle miniaturization is a technical term for hair thinning or balding. What this literally means is that the coarse terminal hair of the scalp turns into thin villus-like hair of the body. This is exactly opposite to what takes place during puberty. Remember how in boys, especially during adolescence, the fine villus hair present in the region of the beard and the chest gets converted into thick terminal hair, but under the influence of androgens and because of the genetic predisposition, this terminal hair that is present over the scalp gets thinner and finer, just like the villus hair on our body, and slowly they just fall off and lead to balding. Now, I've generally seen that the focus tends to be on men when it comes to pattern hair loss, and even the terminology androgenetic alopecia was partial towards the male sex when it was named and coined. But I want you to remember that age-related pattern hair loss can affect both men and women. Male pattern hair loss is the most common cause of hair loss in men, and it usually begins after midlife. It is believed that by the age of 50, more than half of the men will see visible signs of pattern hair loss. So this can include thinning, a receding hairline, or even balding. But in my practice lately, I've even seen many young boys coming in with pattern hair loss, especially during their late teens and early 20s. Now for women, female pattern hair loss begins more commonly after menopause. It is known to occur in midlife when a woman is in her 40s, 50s or 60s, but it can even occur earlier. This type of pattern baldness generally tends to develop slowly, so it is important to learn to identify pattern baldness in yourself or in your family members. Pattern hair loss may simply begin as a receding hairline or a bald spot on the top of your head. In men, hair loss begins in the areas of the temple or the crown of the head. This means it can begin in the side angles of your head or the top portion of your scalp. Some men may just develop a bald spot in the center of the head, but the most common form of hair loss is the recession of the hairline, and this can occur in different patterns. The most common pattern is the M-shaped pattern, where you will see loss of hair or your hairline receding backwards in the side angles of the head. Sometimes the hairline may recede in a U pattern, where throughout the frontal area the hair becomes thin and starts falling off. And this can continue to go backwards till all the hair is lost. I want you to pay attention to this image. It is the image of one of the most popular classification systems that dermatologists and trichologists use to categorize the severity of male pattern hair loss. It is the Hamilton-Norwood classification for androgenetic alopecia. And if you see, as we move from grade 1 to grade 7, the hairline slowly recedes in a gradual and progressive manner. So much so that when we reach the level of grade 7, the hair is completely lost over the entire top of the scalp. Only the back of the head has some amount of hair present. Now, pattern hair loss in women is very different from what we see in men. Very rarely will you see women having a recession of their hairline backwards. What we need to focus in women is the midline partition of the hair. what I want you to do is create a midline partition in your hair and then compare the top of your scalp with the images that are used for classification. Now there are various classifications that are present, but the most common one is this 3-grade system that is given by Ludwig. There is also a clinical grading for female pattern hair loss available. You can find all the images at any time in the blog post that I have linked in the description below. There are a lot of grades and classifications that are available for pattern hair loss. I have kept the 2 most popular and the most commonly used grading and classification systems for you to check and compare. What I want you to pay attention to is the way the pattern hair loss is progressing. So you will see a very thin midline partition that is present on a healthy scalp, but as pattern hair loss progresses, the degree of widening in the midline continues as the hair continues to thin and fall off. So for men, what you simply need to do is lift your tuft of hair and check the pattern of your hairline and how far away is it receding or has it recessed already. And for women, create a midline partition and compare the degree of widening and how much gap or scalp can you see through the hair. This indicates that the hair has thinned out and has fallen off and that pattern hair loss is progressing. So let's summarize what are the symptoms and signs of pattern hair loss and hair miniaturization on the scalp. So that will include a receding hairline, thinning of the hair at the crown or the top of the head, and a widening midline partition. Needless to say, whatever we discuss over here is for pure education and information purposes only. If you are experiencing more than normal hair loss or if you suspect a certain form of hair loss in yourself, then you should consult your dermatologist or trichologist. So let's assume that you were able to visually diagnose yourself having pattern hair loss. So when you will visit your dermatologist or trichologist, the next step that they are going to do is they're going to check your scalp with a trichoscope. That is something like a dermatologist stethoscope through which they can actually magnify and see the hair follicles on the scalp and differentiate the healthy hair from the hair that have thinned out or have become miniaturized. Another good way to determine whether you are actively losing hair is to perform the hair pull test. Now this is again something that your dermatologist or trichologist will perform when you visit them, but this is something that you can try at home as well, but make sure you do it in the correct technique and the correct manner. So to perform the hair pull test, you grab a very small section of hair, roughly around 50 to 60 hair between your index finger and thumb, as close to the scalp as possible. Then you give a gentle but a firm straight upward tug or pull to see if any hair breaks or comes out in its entirety. If more than 4 to 5 hair come out, we roughly say 5 to 10% of the hair that were held. If they come out, that means you are experiencing active hair shedding or hair loss. What this means is that there is active inflammation present in the scalp that is causing the hair follicle to weaken and fall off easily. So then you need to get evaluated and seen by a dermatologist and trichologist so that you can get treated appropriately and in a timely manner. Another very useful tool if you're suffering from hair thinning or any form of hair loss for that matter is record keeping. It is a very good practice to take photographs and keep a record right from the very beginning. But I want you to keep in mind some points which will help you make the best use of it. Take photos of the top of your head every month. Take photos of the side of your head every month. Try to keep the distance between the camera and your head fixed and the same every time as far as possible, and try to take the photographs while keeping the angle the same as well. The more identical the photographs will be, the easier it will be for you and your doctor to compare and analyze the severity and the progress of the condition. Alrighty, this brings us to the end of this video. Aging of our hair is an inevitable process and there are so many factors that come into play, right from weathering, grooming, exposure to ultraviolet light, and factors like a genetic predisposition, hormonal influences, and so many other things that play a role when it comes to pattern hair loss. Now that we have understood what exactly is pattern hair loss and why it occurs, We will discuss the best treatment strategies for this in the coming video. If you like what I share, consider subscribing to stay connected always. Don't forget to click the bell-shaped icon so that you can get notified every time a new video gets released. Till then, stay healthy, stay happy, stay blessed. See you soon.